Physiotherapy is evolving, and so is the role of physiotherapists in shaping the future of healthcare. With rising demands for rehabilitation services and a changing landscape in health delivery, physios are stepping up to take on strategic leadership roles like never before. Hi, this is your Priya Physio, and today we are going to dive into AHP's Deliver, which is a strategy for allied health professions in England, and the strategy is designed to empower allied health professions, including physios, to lead the way in transforming patient care across England. Four key areas of focus as per the strategy: optimizing care pathways, embrace digital transformation, diverse and flexible workforce, and enhancing leadership and research capacity. Number one is optimizing care pathways. As we all know, AHPs are integral to patient care throughout the lifespan, ranging from acute hospitals to community to patients' own homes. And in doing so, the strategy aims to provide digital tools and encourage AHPs to use evidence-based practice. Moving on to the next one is embrace digital transformation. And what does it mean? Embracing digital transformation is basically where AHPs will be delivering digital services more often, ranging from diagnostics to patient management tools to service delivery. On to the third point of the key area, which is diverse and flexible workforce. And I'm looking into the details of what it means is workforce expansion. And when I talk about workforce expansion, it focuses on diverse workforce, upskilling frontline clinicians into leadership roles, and recruitment and retention strategies for frontline clinicians, as well as encouraging them into leadership roles. Last but not the least, it's enhancing leadership and research capacity. So what does it mean? The AHP strategy is trying to emphasize and encourage AHPs to take on more and more strategic leadership roles, so they are in decision making roles and shaping of the services. Another way of leading is also by leading the research in rehabilitation and various specialties that the AHPs are involved in patient care. After we've looked at AHP strategy, let's look at the challenges: workforce shortages, rising demand, burnout concerns, and access to resources and digital tools. Looking at workforce shortages, there is a physio vacancy rate of 11 to 12% in some regions, and that is creating a pressure on system, especially when the demand for services is rising with aging population and chronic conditions like cardiovascular diseases, respiratory diseases, long COVID, and diabetes. Hence, it is likely that this is going to lead to burnout concerns and staff well-being with increased work pressures and less AHPs to work on the front line. Last challenge, or one of the challenges, is access to resources and digital tools. Not all AHPs are well equipped with digital tools. Opportunities: expand into FCP roles. FCP is first contact physios, and first contact physios is a real innovation in primary care, and it's going to bring on more and more roles within primary care. What do FCPs do is first contact physios assess, diagnose, and treat musculoskeletal conditions in community without a need of a GP referral. And that's why I say it's a huge success and transformation in the physio world. Next opportunity is embracing research and evidence-based practice. There is going to be more and more opportunities for physios to research and participate in research and evidence-based practice. Roles by 50% by 2027, and they would like to see AHPs in these leadership roles across the NHS. That's a good news for all of us. Next, there is more focus and more funding has gone into AHP leadership and fellowship programs. So why not make use of them and look out for what's available in your county, in your local area, AHP faculty in each region, in each county, and try and see how you can participate and apply for the fellowship programs. And last but not the least is clinical academic pathways. Is there anything that you are interested in and see how you can seek funding for that via digital innovation, virtual rehab, and remote consultations. So, the strategy aims to focus on virtual rehabilitation programs, remote consultations for AHPs. How do we take practical steps? Number one is pursue CPD. So, as a physiotherapist, I would encourage you to look out for training programs in your local area, in your locality. Look for fellowships and certifications as we discussed in opportunities. Build a network of peers and mentors, a network of like minded people. Number one for physios is Chartered Society of Physiotherapy. There are a number of regional networks, professional networks, safety reps, stewards that the CSP encourages. And that is going to be your first port of call if you're a physiotherapist. And number two, your Priya Physio has also created a Physio Leaders Club on Facebook, which is a community of like minded physios. And I would encourage you all to look out for Physio Leaders Club on Facebook and join the community because together we are stronger. Next, looking at advocating for profession and what good things the profession brings to the holistic care of a patient. So make it a habit of having an elevator pitch ready to say what physios can do and what physios are capable of doing. And you will be surprised to see that how many people in healthcare are not aware of what exactly physios do and what all you can do. So you can be the best advocate for your own profession. All those physios who are watching this video, take on leadership roles. As much as you love your frontline role, be in your frontline role, but lead wherever you are. Advocate for your profession. You can be a band 5 physio, band 6 senior physio, you can be a team leader, you can be a clinical specialist physio, you can be an operational manager, a general manager. Take on leadership roles, look out for them, don't hesitate to apply for these roles. And secondly, I'm in a strategic role, and I would really encourage physios to step up and start looking out for strategic roles. We can even call it non-clinical. I call it non-clinical because you are not going to work with patients on a one-on-one basis, but you're going to work on a service, a commissioning strategy, and you're going to work in that strategic role of improving quality and safety, improving services, improving pathways. And those are the kind of roles that physio shouldn't be afraid of taking because you know you can do that. Now is the time to take action. If you're a physiotherapist looking to move up the career ladder and seek more and more leadership roles, here's what you can do. Number one, start developing your leadership skills today. Start finding a training, a CPD program, or look out for a mentor. Number two, get involved in professional networks. Start with Chartered Society of Physiotherapy. Why not do that and start advocating for your profession? Number three, seek mentorship and coaching to accelerate your development. And last but not the least is embrace change and digital tools to stay ahead in modern healthcare. The future of healthcare needs strong physio leaders. Step up, take the lead, and shape the future. You've got the potential, make it happen.